First, we have to ask ourselves, what is shock? Shock is circulatory failure causing inadequate perfusion of tissues and organs. What this means is that there is some underlying process going on in the body that's preventing us from delivering adequate oxygenated blood to tissues and organs. And this can lead to things like tissue hypoxia, cell death, and eventually organ failure. Now that we have a good understanding of what shock is, we're going to start talking about the different types of shock. In order to better understand the different types of shock, we're going to be using the simple analogy using a gas pump. I think this analogy is great because it really outlines the underlying mechanism of each type of shock. So here's how it works. The gas pump represents the heart, which makes sense. The heart functions as a pump to deliver blood to the rest of the body. The gas hose represents the blood vessels or vasculature, and this makes sense. They're going to deliver that gasoline or that blood to the rest of the body. The gasoline is going to represent the blood or plasma volume. And finally, the vehicle is going to represent the tissues and organs that are receiving the gasoline or the blood to function. So if you think about it, there are four main ways in which the gas will not be delivered to the vehicle. In other words, there are four main ways in which oxygenated blood will not be delivered to tissues and organs. The first being the gas pump doesn't work. The second being there is no gas to fill up the tank. Third, there's a gas blockage that's preventing the gas from entering the vehicle. And lastly, there's a problem with the gas hose itself. So whether you know it or not, we just walked through the four main types of shock. Starting with the gas pump not working, this represents cardiogenic shock. We said that the gas pump represents the heart. Well, if the gas pump isn't working, meaning there's poor cardiac function, this could compromise cardiac output and lead to decreased blood pressure and decreased perfusion to tissues and organs. Then we said there is no gas. This represents hypovolemic shock. There's not enough gas to fill up the tank, meaning there's depletion of intravascular volume. This could be due to things like fluid loss or bleeding, and there's not enough circulating volume to perfuse those tissues and organs. Then we said there could be a gas blockage. This represents obstructive shock, where there's something obstructing the gas from being delivered to the vehicle. In other words, there's some underlying process going on in the body that's obstructing blood flow, and that makes it difficult to perfuse tissues and organs. Then we said there could be a problem with the gas hose, and this represents distributive shock. This is a problem with the blood vessels or vasculature. This could be due to vasodilation and or increased vascular permeability. Whatever it be, it's making it difficult for us to deliver the oxygenated blood to tissues and organs. So now that we have a good understanding of this analogy and how we can apply it to the four different types of shock, let's talk about each type of shock independently, starting with cardiogenic shock. We said that in cardiogenic shock, that's when the gas pump is not functioning properly. Well, if the gas pump is not working properly, it's not going to be able to deliver gas to the vehicle. In other words, there is a problem with the heart, which represents the gas pump, and it's not going to be able to deliver oxygenated blood to the rest of the body. This poor cardiac function can lead to decreased cardiac output, and we know that cardiac output is one of the variables to blood pressure. So if cardiac output is compromised, this can decrease blood pressure and potentially lead to cardiogenic shock. So what are some of the underlying causes that can lead to cardiogenic shock? One major one is acute coronary syndrome. If the patient is suffering from ACS and they're not getting adequate oxygenated blood to their heart, this can lead to poor cardiac function, and if severe enough, it could lead to cardiogenic shock. Another example is dysrhythmias. If a patient is presenting with an abnormal heart rhythm, whether it's fast, slow, or irregular, this can compromise cardiac output, and as we know, that can decrease blood pressure and perfusion. Another example is heart failure. A patient with underlying heart failure may present with an acute on chronic exacerbation of their heart failure, and if their cardiac function is poor enough, they may present in cardiogenic shock. Problems with the heart valves can also lead to cardiogenic shock. If a patient has any kind of valve stenosis, this can compromise cardiac output, but also abnormalities to the valve could lead to things like regurgitation, which is backflow of the blood in the wrong direction, and this too can compromise cardiac output. Another example is drug toxicity. Let's use beta blockers as an example. We know that we use beta blockers to control things like high blood pressure and fast heart rate by slowing the heart rate down. Well, if someone overdoses on beta blockers, this extreme slow heart rate could compromise cardiac output, and if severe enough, they may present in cardiogenic shock. Another example is myocarditis. This is inflammation of the myocardium, and this inflammation of the myocytes can lead to decreased cardiac function. The final example is trauma-based. If someone is suffering from myocardial contusion, this can also negatively impact cardiac function and compromise cardiac output. The treatment of cardiogenic shock is going to be focused on fixing the underlying problem that's causing it, but you may have to put them on pressor medications temporarily to keep their blood pressure up and allow for adequate perfusion. Let's now move on to hypovolemic shock. We said that another reason that the vehicle may not receive gas is because there is no gas. In other words, there is decreased intravascular volume that's leading to decreased perfusion to tissues and organs. Now, this could be a result of decreased fluid intake, such as dehydration, or it could be due to increased fluid losses, such as intractable vomiting or significant diarrhea. Another cause of hypovolemic shock could be due to blood loss, and this could be in the form of GI bleed or any type of hemorrhage. But hemorrhagic shock is another type of hypovolemic shock. And the treatment of hypovolemic shock is going to be focused on repleting whatever fluids are being lost. This could be in the form of IV fluids, crystalloid, colloid, blood products, whatever it be, but you want to focus on replacing whatever is being lost. Moving on to obstructive shock, this is when we said there's some kind of gas blockage that's obstructing the delivery of gas to the vehicle. In other words, there's some underlying process going on in the body that's obstructing normal blood flow and compromising perfusion of oxygenated blood to tissues and organs. An example of obstructive shock is a pneumothorax. Pneumothoraces can lead to increased intrathoracic pressure, which can lead to decreased venous return back to the heart. This can then decrease stroke volume, decrease cardiac output, and decrease blood pressure. Another example of obstructive shock is cardiac tamponade. The increased pressure around the heart can lead to right ventricular collapse during diastole. This can lead to decreased filling during diastole and ultimately lead to decreased cardiac output. The final form of obstructive shock that we'll briefly talk about is pulmonary embolism. A PE can obstruct the normal blood flow through the pulmonary artery, and this can lead to obstructive shock if it's severe enough. Now, the treatment of obstructive shock, as we have seen with the other forms of shock, include treating the underlying problem. So, for example, this could include a chest tube for pneumothorax, a pericardiocentesis for cardiac tamponade, or blood thinners for pulmonary embolism. Let's now talk about distributive shock. Using the analogy, this was a problem with the gas hose, and we were unable to deliver gas to the vehicle. In other words, there's a problem with the blood vessels. Either vasodilation and/or increased vascular permeability is making it difficult to deliver oxygenated blood to vital tissues and organs. Remember when we talked about cardiogenic shock, we said that blood pressure was determined by cardiac output and peripheral vascular resistance. Well, cardiogenic shock is going to affect the cardiac output. Distributive shock is going to affect peripheral vascular resistance through that vasodilation and increased vascular permeability. And if we decrease peripheral vascular resistance, this is going to decrease blood pressure and perfusion. Some examples of distributive shock include septic shock and anaphylactic shock. In both of these cases, increased inflammatory markers and mediators lead to vasodilation and increased vascular permeability, and this can lead to decreased blood pressure and perfusion. Another example of distributive shock is neurogenic shock. Injury to the central nervous system can decrease sympathetic tone and lead to bradycardia and hypotension. There can also be toxicologic causes that lead to distributive shock. For example, calcium channel blocker overdoses could potentially lead to vasodilation, especially if taking a calcium channel blocker that acts more on the vasculature rather than the heart. The last example we'll talk about that can cause distributive shock is an adrenal crisis. Decreased cortisol levels can lead to hypotension, and this can potentially lead to a shock state.